able to walk up Stone Mountain again.
So
And you would think also, let me just say real quick, people think, oh, this is going to be painful, it's going to hurt, and everything. It's not. You don't feel anything. You know, I mean, it's just as painless as it can be. And if you bring a book and then actually read the book, you've got time to do that.
So do you have any changes in the way you feel physically before and after you do the IV drip?
Well, I haven't, other than that sensation that right calf is not sore. And I haven't really gone and like walked around the grocery store for a half a mile just to see. But I intend to do that this weekend just to test drive this because I have had before, one of the main things the vascular surgeon says is you have to walk. Because if you walk, two things will happen. It'll help to push some of that calcium. But in places where it narrows down, it can't, it will build new arteries around. So it's like walk or I start cutting stuff off of it. You know, he says, this is what I tell my diabetic patients. You know, those toes die, you can't leave them on there. You know, and if your foot dies because of no circulation, then you have to do something about that. And I'm like, I'll walk. I don't want you cutting anything off of me. You made a book. And I don't know how people argue with that. I mean, you know, he's going to cut stuff off of you for real. You know, so you know, again, this is just, to me, I just really believe that this is going to work, and I'm going to get back to being where I was before, which is just, I just want to be able to walk up Stone Mountain, go to the grocery store and walk around, mow my lawn, which I cannot do because I can only go up one side of it and have to stop and rest for 10 minutes, you know, for the artery to get well again. I have neighbors looking at me like, look at that guy, he's got his wife mowing the lawn. You know, because if she doesn't mow it, it doesn't get done. You know, and it's so they're all wondering about me. But you know, it's not something you can talk about. Try to tell people, oh, you know, I have bad arteries. I wonder if my wife will believe that. She'll mow the lawn. So
exactly. So after you actually get the IV back, do you have anything that anyone would consider negative? Like,
no.
Do you feel lethargic at all? There's no tiredness. There's no brain fog. There's
none of
nothing
that.
that anybody would be concerned about.
If you just get up and you feel real good, and or you just feel good, and you're going through your normal day, and you don't have any pain or any irritation, you don't have a cold or the flu or something like that.
Right.
That's how you feel when you get through here. It's like, it's normal. You know?
Excellent. So how many times a week or how many times a month do you do this?
Well, we have just started. This is the finish of our second week. We do the Plaquex on Monday and Wednesday, and then we do the chelation on Friday. And Plaquex tells folks, don't overdo this. It needs time to seat itself in the body because it's regenerating cells. I'm not sure of that process. Again, I'm not a scientist, so I'm not sure how that's working, but apparently it's doing something inside. And again, the chelation is to get anything else knocked loose, those other bad metals that are floating around in all of our bodies.
Right.
So they talk about, I think in the literature, doing at least 10, maybe 20 Plaquex sessions. And then of course they say too, if you really, really have hardening of the arteries, and the doctor said pretty much, go home and get your affairs in order. You may have to do 30 or 40 of the sessions, but at least I had a friend that died of hardening of the arteries. There was nothing anybody could do. And when he heard that he had that, the blood drained out of his face because he knew that's it. That's like saying you're stage 4 cancer, and about 20 minutes from now, you're gone.
Exactly.
And that's the way he felt about it, and it was less than a year until he died. That's just gruesome to me. So, and even if this was painful or uncomfortable or anything, I'd do it. It's like going to the doctor or going to the dentist.
Yes.
This is going to hurt. The Novocaine's going to sort of help, but you know, do you want to look snaggletooth, or do you want to have your teeth fixed? So
Exactly.
you put up with that, and I didn't know what to expect with this. I've never had IV therapy, and it's simple and it's painless, and you can see it working. You know,
Absolutely.